Yes.
So whether you've been curious about homeopathy or your day-to-day lifestyle or a lot of questions about how homeopathy works, this session is totally for you. Hello everyone, this is Purti Vutukuru, and today we have with us Dr. Prithvi, who has done his bachelor's in homeopathy medicine and surgery and PG homeopathy from Allen College of Homeopathy with amazing 14 years of dedicated practice. Hello,
Hello,
doctor.
hi.
We're totally honored to have you here.
Thank you, Shikha.
So a lot of our customers from US, UK, and other parts of the world globally have a lot of questions about homeopathy and where to begin and to find the right approach. So the basic question to start with is what exactly is homeopathy, and how is this science different from all other sciences out there?
Yes, coming to the point, what is exactly the homeopathy word? So, homeopathy was derived by the person Samuel Hahnemann, who was a German. So, what exactly homeopathy is when a like cures like. So, the same concept is different with comparing to allopathy.
Okay.
So, wherein we when the sick person, we have a sick person and we have a healthy person. So, when a drug is given to healthy person, so we create some sort of symptoms. Okay, the same symptoms which we create in a healthy person are curable by the same drug in a sick person. So that is how the exact principle of homeopathy works on.
Okay.
So like cures like. So what exactly the drug creates is some sort of symptoms in a healthy person. The same symptoms are cured or in a sick person.
Okay.
So that is the same totality we tend to take in a sick person.
Okay.
So for instance, when I give some X drug to a healthy person, so the X drug creates some sort of cough, some dry cough or loose cough, and also the occipital headache. And if you come to menstrual irregularities, so the proving tends to from top to bottom, from head to toe. So we tend to take all the provings of a healthy person
Okay.
after administration of the homeopathic drug, some
Okay.
XY drug. So we note the things exactly in the way the prover tells us, and thereafter the same proving we tend to observe in some set of patients,
Okay.
all healthy patients, some 10 to 20 patients. And if we get to know that the all the patients are proving the same symptoms, then we document the same symptoms and we create a meteor medica out of that.
Okay.
And this we tend to document in homeopathic pharmacopoeia. We have a book called homeopathic pharmacopoeia.
Okay.
So and we prove all the documentation out there,
Okay.
all the provings which was proved by the persons, the healthy
Okay.
persons. And the same proving symptoms or signs whatever it is tend to get cured in a sick person.
Okay.
So for instance, X drug create nausea in some person, and if we get a sick person with same type of nausea, so we give this X drug to him and it
Okay.
cures. So it's nothing but like cures like.
So it's more natural.
Natural way of
Natural
healing.
remedy and
Exactly,
yeah.
exactly. Natural way of healing
Okay.
without any side effects or minimal side effects, and a milder dose and a
Okay.
rapid and gentle healing.
Okay. And now I think we have a lot of options available in the market, right? If somebody has to go pick homeopathy, why should it be homeopathy?
To be honest, why it should be only homeopathy, I really want to say that homeopathy, when you start taking, so it generally creates a gentle healing,
Okay.
a rapid, and if you can say if you can control your lifestyle properly, and if you have diet and regimen properly, then I can definitely tell you that you can maximize your results with
Okay.
homeopathy.
Okay.
Unlike orthodox, wherein you need to take the medicines for a pretty longer time.
Mm-hmm.
So if you come with homeopathy, so a simple dose, or a minimal dose, or medicines for a pretty a shorter time,
Okay.
along with proper lifestyle modifications, it creates miraculous results and marvelous results. You can't even think about it.
Okay. So we need to be a little patient with the process.
Yes, it's not only about the patients, it's also about the way you live. You also need to change the way you live.
Lifestyle.
Exactly. You also need to change the way you live, and you also need to tell all the symptoms to the doctor, treating doctor,
Mm-hmm.
so that he can analyze your case and he
Okay.
can repertorize and he can come to a conclusion what exactly he might need the
Okay.
drug. It all depends upon the case taking. We have a quote in homeopathy: a half taken, a full taken case is half cure. So a full taken case is nothing but a patient when he tells all the symptoms,
Mm-hmm.
and from what exactly he is feeling and what exactly he's tending to see in his way of living. And after the altered disposition, we call it as altered disposition.
Okay.
And when the physician he is able to grasp all the symptoms from the patient, and if we can analyze it properly as per the homeopathic principles,
Mm-hmm.
then definitely I can assure you that he get a rapid prescription and a gentle one.
Okay. As you have a 14-year experience in virgin homeopathy, I was very curious to know what virgin homeopathy is. Can you explain us
Yes, it's
a
a good
little about
question.
it?
So virgin homeopathy is nothing but we have many systems in homeopathy. Some people tend to use the author of another one. We have
Okay.
many authors in homeopathy who has gone to their own philosophy. So
Mm-hmm.
what virgin homeopathy is, it is nothing but the exact principles and the exact way of practicing as per the principles of founder of homeopathy, the Dr. Samuel Hahnemann.
Okay.
So it is nothing but the exact and neat way of prescription and prescribing a drug or treating a patient as per the principles laid by the founder of homeopathy. Nothing other than that. Like we have many philosophies in homeopathy, wherein they divert the situation from the founder of homeopathy.
Okay.
So it's all about how we treat the patient as per the principles laid by him. So he has created some principles.
Okay.
So according to those principles, we need to take a case or treat a patient, whatever it is. So it's all a principle based, a law
So
based.
yeah, it's much more like sticking to the basics then.
Exactly, sticking to what exactly homeopathy is.
Yeah.
So we are treating the patient as how it was founded by the master and
Right.
man.
That so basically sticking to our basics, right?
Exactly.
Okay. So what inspired you to take homeopathy in the very first place?
So the thing is, my family is a great fan of homeopathy.
Mm-hmm.
So my grandparents they used to sought to homeopathy for from simple issues to complex issues.
Okay.
And thereafter we have been habituated all family members they tend to even divert to homeopathy. So for simple to complex issues, so then there was a case wherein my sister got cystic acne. Cystic acne is nothing but acne which is very hard and nodular, which is
Which is very
painful,
common
which is
also
very
nowadays.
painful
Yeah.
and reddish. So she sought to orthodox treatment, and it was it was not going it was not vanishing, and it keep coming, and so there was a situation where she has to give hope, give up the hope. So there was a situation wherein she had been to a homeopathy
Mm-hmm.
doctor who was treating also my grandparents.
Okay.
So wherein she felt really better in not just in just couple of weeks. So to be to be honest, so it was in a month she has developed a marvelous result, and we can't even find a single mark on face.
Oh.
So I just thought how come a simple sugar pills can treat such a cystic acne which has been treated by orthodox doctors from all 6 months, and topical steroids, whatever they have done whatever they would like to have, and they have so this turned me I just started I need to explore it. So I was very curious how come a sugar pill can convert this sort of cystic acne to a curable condition. So then I thought I need to explore it deeply. So I thought let me take a chance, and I got into
So
homeopathy.
it started from curiosity, basically.
Exactly,
Curious
exactly. I
seeking.
was very curious about it. So that's how I was into homeopathy.
Okay, just like you mentioned about the sugar pills, I remember, when I was a kid, like I remember taking a whole bottle of homeopathy because it tasted sweet, and I'm pretty sure like a lot of them can relate to this. So coming to this, so there can also be kids who are like very fussy about taking a certain things, or being a little complicated, and not everybody likes sugar pills. So, first question is it like safe for kids to take homeopathy?
Yes, definitely it is a safer medicine for even newborns.
Okay.
From newborns to adolescents to geriatric patients.
Even
we can
newborns.
Yes.
Okay.
From day one, we can administer the drugs or medicine, whatever it is, for a patient
Okay.
who also needs the medicine for their condition.
Okay.
So wherein we cannot have proper treatment or proper management from orthodox sort of things.
Okay. Um, So, like, it's totally safe for the newborns as well.
Yes, it is totally safe. Like, when you feel a patient is having fussy, so fussy, and is
Mm-hmm.
like, reluctant to take a medicine, then we also have like, some sort of administration types. Like, you can even have it administered in mother's breast milk. You can
Oh,
even like, add some medicine, some XYZ medicine in breast milk. Like,
okay.
take in a container and mix the medicine in the breast milk, and you can administer it like, as a
For the
teaspoonful for
newborns.
the newborn. Also, you can administer in like, their parts, like inner thighs, inner parts of the thighs,
Oh,
or inner parts of their arms. Like, just you can call them as biceps, or just
okay.
below the axillary surface. And even like, you can give it as a mode of olfaction. So
Okay.
you can just make them smell the bottle, like, whatever the XYZ medicine is, you can
Okay.
just make them smell. So it creates the same efficacy as you
Like the oral
administer. Yes,
consumption.
yes.
Okay. This is for the like the just borns
Not,
or even the kids
yes,
of
in
below
everyone,
10 years.
in everyone. Like, even the
Okay.
patients. Like, I can give you an example. We had a patient in ICU when I guess it's a couple of years ago. So I was treating a patient who was in
Okay.
ICU. So he was on intubation. He was on ventilation. So he was not able to swallow, or like, he was into Riles tube.
Okay.
And like, later on, even Riles tube was also removed. And he was like, have they created a sorry they created a gastrotomist tube. They created a
Okay.
gastrotomist tube,
Okay.
and I started administering the medicine through gastrotomist tube.
Okay.
So wherein like, even it was a marvelous effect, and it created the same effect as like, we do administer in the oral way. And you can
Oh,
even give them in like, Rell's tube, gastrotomist tube, whatever. Like, you feel anyhow. When you feel that the patient is not able to take any medicine,
okay.
or he's like, comatose in condition, or in delirious condition, when you feel that he is like, reluctant to take a medicine. If you
Okay.
can see in alcohol withdrawal symptoms or delirious patients,
Oh,
and you can like, you can treat them according to the way which I told you. Like, you can administer the medications according to the way which I told you. It was not only created by me, it was created by the founder of homeopathy, the ways, and they are really very effective.
okay. So
It
these
was tested.
ways other than oral consumption is a this is applicable for all the age
Anyone,
groups,
anyone,
irrespective of
irrespective of their age,
age.
irrespective of their age.
Oh, that's
And
amazing.
yes, there are ways like, wherein you can even add them into the food they take,
Okay.
or the drinks they take. You can take any XYZ medicine in proper potency
Okay.
as per requirement, and you can even administer them in like, the way they take the food or drink.
Okay. I remember my friend complaining about PCOD and thyroid at the same time. We're hardly in our 30s, and PCOD. I've seen a lot of people suffering with PCOD post their 25 itself. So also they've been complaining about the side effects of of certain things that they've been using and everything. So what kind of role does homeopathy play in PCOD and thyroid?
Definitely, I can let you know that these all PCOD or Hashimoto's thyroiditis, whatever you feel like, diabetes, they all are nothing but the lifestyle disorders. So
Right.
if you plan your lifestyle properly, the way you wake up, the way you live, the way you
Mm-hmm.
exercise, the way you eat, everything really matters. So if you keep them properly, then there are really a great number of ways that you can stop these diseases from like, coming to you. And if you want to use homeopathy properly, then I will definitely suggest you to like, just try to avoid the circumstances which you feel that might have been triggering your condition,
Mm-hmm.
and try to make up a lifestyle, proper lifestyle, like, which is really making you getting like, proper results, along with like, proper administration of medicine. So
Okay.
there is no such medicine that can cure PCOD or thyroid,
Thyroid.
like, without proper lifestyle modifications. There is no such thing. So along with the proper medication, you also need to have a proper lifestyle.
Lifestyle as well.
Yes.
So, does homeopathy have side effects like for PCOD or thyroid? People
If
using
you
it
take
to.
it in proper, like, proper dose and proper way from the like, proper qualified physician,
Mm-hmm.
then definitely I can say there are minimal ways of getting like, aggravations or whatever it is, side effects. So I can
Okay.
pretty well say that there are no side effects.
Okay.
So
So managing lifestyle and homeopathy, you think it
yes,
shows
yes,
pretty
yes,
good
definitely,
results.
definitely, definitely.
Okay. One more, issue, like, we've seen in the recent times, every other third person has diabetes, or even, even the young children, it's there. So, what kind of role does homeopathy play in diabetes? Like
Yeah, the same answer I would tell you give you. Like, it's
the
a lifestyle
lifestyle.
disorder, and you need
Okay.
to keep a check on your diabetes readings, your sugar readings.
Okay.
So sometimes the person who also takes homeopathy along with allopathy medicine and having proper lifestyle modification, he tend to get a fall in his sugar levels, and he may end up into hypoglycemia, and
Oh.
even that might create a very emergency situation.
Taking both simultaneously?
No,
Or
if he is not having a watch on his sugar levels,
okay,
he need
got
to
it.
watch it
Okay.
properly along with proper lifestyle. And when he also takes both medicines from allopathy and homeopathy, by having proper lifestyle modifications, he need definitely to watch his sugar levels. He
Okay.
might end up into some serious situation.
Okay.
Like also, if he gets hypoglycemia, he also might have gone to a comatose condition. He might even end up into comatose condition, along with seizures.
Okay.
You may lose a patient if you
Okay.
can
If
not
there's like
properly.
no proper watch on the sugar
Yes.
levels.
So they need to watch it properly.
But can their resort be like, first homeopathy, like, for people who have diabetes? Can they
Yeah.
like take up homeopathy in the very first place? Can they
Definitely,
approach?
definitely,
Can they
definitely.
have that approach?
Definitely, they can
Okay.
have that safely. But only thing is they need to get into the place in time. Some people they develop. It's a silent killer. When you say it's a
That is
silent
true,
killer.
yeah.
So people tend to get the results accidentally when they get it done either in their corporate offices, whatever. It's accidental
Yeah,
finding.
people, a lot of them won't even know, like, yeah.
It's an accidental finding, and till that time they might have ended up into complication, maybe in the form of neuropathy, nephropathy, or there are retinopathy, eye changes, kidney changes,
Yeah,
nerve
yeah.
changes. So it should not be late. So I better suggest everyone have a regular checkup, maybe once in a year, so that they can have a proper watch on their vitals and their
Okay.
laboratory test, so that they can find proper doctor near to them.
Okay.
So that's how they can be healthy. What I
So your
feel.
pro tip is have regular checkups and
Yes, yes,
having a
yes.
lifestyle, like proper lifestyle.
And I,
Yeah.
I definitely tell you guys have a proper watch on your even weight.
Okay.
So do not increase your weight, and need to properly
Weight
manage
management, yeah.
their BMI, and also be aware of all bad habits. What I suggest, at least you can lessen them. At least
Yeah.
you can try to lessen them. Have a proper sleep, and try to avoid night shifts if possible. Night shifts,
Right.
okay, and stress free. Anyhow, I know definitely know that you cannot have a stress free life these days, but at least you can have a try on that, properly managing meditation, having meditation properly, stress free, having a simple walk in a park, and spending a lot of time with your family members, your kids, whatever it is, whichever makes you stress free,
And happy.
happy.
Right. Okay, so I think we've received like a overwhelming response from, all our customers from different parts of the world globally. And as we, our main thing is, the wellness products, and we ship like all over the world, like globally. So I think we have pretty good questions from them. So we'll just take it up.
Yeah, sure.
So one of a customer had asked, like, what best treatment for irregular periods? Yeah, I think I've heard about this a lot as well. I think it's
Yes.
because of the stress, or
There are
lifestyle.
many
Yeah, yeah.
conditions. There are many causes for irregular periods. Might be a cause you can have a check on your stress levels, and you can also have a check on your testosterone levels, and you can also have a check on your diet, wherein you consume a lot of sugar, carbohydrates, a lot of dairy products, and just have a regular checkup, and you can find something if you have something fishy, you can find it in USG abdomen ultrasound scan. If you find any PCOD conditions in scan, I
Okay.
better suggest you just consult your nearby physician, and just have
Okay.
a brief discussion on it, and you can just manage how exactly you need to consult either the homeopathy physician or allopathy physician, whatever it is, a proper
Okay.
gynecologist or a homeopathy physician. So
Okay.
that's how it works.
So I can always approach homeopathy for irregular periods.
Yes, definitely. I have seen many
Okay.
cases.
Okay, and one of a customer had asked, like, my husband has diabetes and takes two medications. One is like the normal medication, and one is the injection, and once a week. So, is there a possibility of replacing this with homeopathy instead? And he also takes medication for his heart and blood pressure.
Yes, it is a very complex situation wherein the person is also having diabetes uncontrolled type, wherein he is using oral antibiotic and
Yeah,
anti-diabetics also insulins.
insulin.
So he is also having heart condition wherein
Mhm.
he is also taking heart medications. I definitely tell them to have a closer look at their levels,
Okay.
and do not stop the medication until and unless you find a proper answer from your either general physician or your homeopathy physician. You just have a closer discussions with them, and
Okay.
make sure that before you stop any medication you just consult them, and you just need their advice. I just suggest never ever stop any medication of allopathy without properly consulting the general physician or whoever you consult,
Okay.
and also the one homeopathy physician who you consult. You
Okay.
should not stop them.
Okay. So, I mean, cases like this, in the severity, also homeopathy can be taken.
Yes, yes, you
Yeah,
can
it
you
can be
can take up.
managed
Yes,
by
it can be
homeopathy.
managed. It can be
Okay.
managed, but there are ways of stopping the medicine. You
Mhm.
cannot stop a medicine
Directly, yeah, you
yes.
need to, yeah.
So there are ways to taper doses and to have a closer look at your levels and modifying the treatment regimen.
Okay.
So these are the ways you cannot stop them abruptly.
Okay. So one more question is severe kidney stones 9 mm. Anything for gallbladder, stone issues?
Yes, I can just tell you for kidney stones, if it is less than 8 mm or 9 mm,
Mhm.
then you can definitely have a proper management with the water. So take plenty of water and avoid protein foods, and even for gallbladder stones too.
Okay.
So you have the same diet regimen. Avoid animal protein,
Mhm.
and which also known as you can just think about having milk or milk products, dairy products, and meat, and all meat products, anything which comes from animal.
Okay.
So
All
you just
dairy
make
and
sure that you just avoid them for time
cut it
being,
down. Okay.
and you can again restart in a specific moderate way, not the way which you used to take in in earlier days.
Okay.
Along with proper water and proper medication, definitely I can suggest them, they can have a proper response from homeopathy.
So lots of water is also
Lots of water is
yeah.
more, lots of water, and make sure that you won't end up into dehydration.
Hmm.
Okay, there are things, there are
Yeah, because
process.
yeah, more than like 3 liters when a
It's
person.
not 3 liters. So whenever he feels thirst,
Mm-hmm.
so your body only tells you when to drink water.
Okay.
Okay, if you end up drinking plenty of water and pee, getting
Yeah.
them excreted in urine,
Yeah.
you might end up into electrolyte imbalance. So wherein you might even end up into hyponatremia, hypokalemia. There are electrolytes, some sort of electrolytes in your body.
Okay.
So if they are depleted, so you end up into some another situation. So which
Right.
is again complicated one. So just have a closer watch on it.
So I have a controlled.
Yes, anything should be in control, not to
Okay.
be in extreme.
Okay. So one more thing is fluctuating blood sugar as well as pressure. Which homeopathic medicine to be taken, to stabilize the fluctuations for blood sugar and blood pressure? Would you suggest anything?
So it's not that we do not have any specific medicines for any specific disease in homeopathy.
Mm-hmm.
It's all individualized treatment. So you need to have checked with proper homeopathy physician, wherein he analyzes your proper case taking, and
Okay.
from top to bottom he tends to take the symptoms and signs. He analyzes the case, and he he tailors your medicine
According
in a
to
proper way.
Okay.
So never ever think that you have a specific medicine for a specific condition.
Mm-hmm.
So you don't have any specific medicine on homeopathy.
Okay.
So for kidney stones, you have some X medicine. For diabetes, you have some Y medicine. So there is no
No.
such thing, and never ever believe in that.
Okay.
So individualized treatment is the only option, is the only way to get rid of your illness.
So it's curated for
Yes, as a
everything.
whole, as a whole.
Yeah. Okay. Next is how to control excess burping, constipation, and blood pressure. Blood pressure, I think we've discussed. Excess burping and constipation.
So it's all related to gastric issues.
Yeah, that is also a very common
Yes, it's
thing
all related
nowadays.
to gastric
Yeah.
issues, and even the gastric issues they trigger when you have more stress. You need to have a proper watch on it. and take the meals on proper time, and take plenty of water, and make sure that you poop every day. And if you have any issues like getting some acidity sort of symptoms, then make sure that you get some endoscopy done or some ultrasound done. So wherein you might have been having some fatty liver. So fatty liver also produces symptoms just like dyspepsia, some slowness in digestion.
Okay.
So according to that, you need to treat the condition. So not every burping condition or not every bloated condition is the same. So they have some underlying pathology. So you need to identify the underlying pathology and you need to address it properly accordingly.
Okay.
So you cannot treat it as generalized condition. So nothing is called generalized. So every disease has their particular pathology.
Okay. So depending on that,
Yes,
certain things
yes,
curated for you.
yes.
Okay. Next, how to stop frightening dreams in the middle of night?
So
Is there any homeopathic treatment for that, or?
we have medicine, but we need to identify the cause, because some kids you can see when they get beaten up by the teachers in schools, or they have some fighting with their friends, or someone when they are passing on road. So they might have seen some accident or some dogs are running behind them. So these are some sort of examples. So
Right.
So they tend to remember the things when they are in sleep, deep sleep. So they they think of the things which are seen in their regular life,
Right.
their regular life. So those only are the symptoms which they get in dream.
Okay.
So if you can treat the fear in them, what has been exactly with, if you see when you find the kid which had a dog behind him on the other day. So you just make sure that you just make sure that you have a conversation with him, telling that no, nothing is going wrong. So dog won't create any any illness to you, and you just do not poke to dog.
Okay.
Okay, so that's how you can create some sort of thing in a kid, making sure that he won't be having some this type of panic attacks again.
Just a reassurance.
Yes, yes, reassure them, stating that nothing is going to create fussy in thereafter.
Okay, but there's homeopathic medicine,
There are
treatment
medicines,
in
there are
this
medicines,
area as well.
there are medicine, but you need to block the cause. Once
Right.
you block
Yeah,
the
the
cause,
root cause. Yeah.
you need to block the root cause. What you just said.
Okay. And one more is someone was telling about having a lipoma. So
Again,
does
I can tell you
homeopathy?
the same thing. We need to have proper case analysis, and then only we can treat them. There are many medicines. There are many medicines which people tend to take as specifics, but I would not suggest them to take specifics. Consult a proper homeopathic physician and make the case analyzed, and then take proper medication.
Okay.
So lipomas are condition when you cut any lipoma, again you can see on the other side.
Oh.
There are many conditions when you get operated on two lipomas, when they tend to excise and remove the two lipomas, again you take four out of them.
Okay.
So there are some patients I have seen where they develop lipomas all over the body.
Oh.
It's not only in specific area; they develop all over the body. So it should be treated in proper way by addressing the root cause and everything.
So root cause is important
Yes,
for
root cause,
everything, basically.
root cause, and proper lifestyle as usual.
Yeah, that's your pro tip.
Mhm.
So I think we've been receiving a lot of live questions as well. Let's take up a few of them. My grandson, aged 4 years, has vertigo. Is it safe for kids to take homeopathy? How to administer it safely? I mean, for a 4-year-old kid who has vertigo.
So again, I would suggest 4 years age, a kid having vertigo. So you need to have a proper checkup on that, because
Okay.
vertigo has many conditions, many causes. Sometimes it might be related to your ear. So if you have any any issues with your ear, inner ear, middle ear, so you tend to develop vertigo. And there are situations wherein you develop the vertigo from the effect of brain. So if you have any issues in brain, so you tend to develop vertigo. And if you have any issues with your electrolytes, you tend to develop vertigo. So there are many causes of
Electrolyte imbalance also causes vertigo.
definitely, and even
Okay.
dehydration causes vertigo.
Okay.
Make sure that you just have a closer look on your kid or grandson, whoever it is. just whether he is having proper diet or not, whether he is
Okay.
having proper sleep or not. So there are many ways you properly make sure that you just address them properly,
Mm-hmm.
get the test done, and if you find any difficulties or any issues with the condition which you make a test on it, make sure that you just consult a physician near to you and have a proper treatment.
Okay.
You cannot treat with a specific drug, whether beta whatever it is. There are many drugs which can treat vertigo, but before using any drugs, you
Mm-hmm.
just have a proper checkup and make sure that every test you got it done is safer, is normal, or if you find any abnormal, you just have a discussion with your treating physician,
Okay.
and they will decide how exactly it needs to be addressed.
Okay. Okay. So, and we're seeing a lot of questions regarding, constipation, burping, and blood pressure. So it's the common. I mean, it's the basic lifestyle, and along with homeopathy,
Yes,
basically.
yes, yes, yes.
Okay. So we've also seen a question about kids being so fussy, and how to administer homeopathy safely, like you mentioned previously. But are there any other ways, like how you've explained about
Administering the medicine
the
through
smell, yeah,
breast
yeah,
milk and olfaction,
yeah,
along with rubbing them on inner parts of thighs or
right,
inner parts of your arms, and
right,
also administering them by mixing in drinks what they drink and the food what they take.
okay,
So these are some sort of some types of administrative methods. If you find any fussy child or the person, any adult person who is reluctant to take the medicine, or who
mm-hmm.
is delirious, or who is comatose, you can also administer it through pet tube or rail tube, whatever it is.
Okay. And one more question is it homeopathy, is it safe for people who has asthma and other lung issues?
Yes, definitely. We have many drugs, and we have a lot of scope in homeopathy. If you come to know the respiratory conditions, there
Yeah, the
are, yes,
respiratory conditions,
yes.
right?
It is not only the asthma that troubles the person. There are many conditions if you can see the COPD, asthma, bronchitis, bronchiolitis. There are many conditions wherein the person end up into dyspneic condition. They tend to have dyspnea, shortness of breath,
Mm-hmm.
and sometimes low oxygen levels in their blood
Right,
levels. And sometimes they might end up into a situation wherein they need to get oxygen, supplementation,
right, right.
oxygen supplementation.
They're
And
on
if you,
constant oxygen supply.
yes,
Yeah.
exactly, exactly. If you ignore that, if
Mhm.
you ignore it and you end up into a situation wherein you need to be intubated and put on ventilator, so never ever take easy on your respiratory issues. Make sure that you take proper medications, whether you consult your homeopath or your allopath, whoever it is. Just make sure that you have it properly. And if you find any difficulties, I definitely suggest whatever pathy you are using, just
Mm-hmm.
consult him regularly,
Okay.
and you just make sure that you tell all the issues which are triggering you, take a notes of it. And there are some triggering factors asthma. Some people might have curd or cold drinks, and they tend to get a triggered asthma. So you just have a look at them and take a notes of it, and you just tell the homeopath whenever you consult him. So these are the things which are making a trigger to my asthma. So these are
So
the
you'll
trigger
have to keep a
conditions.
note of your triggers as well. That is
Exactly,
very much important.
which is very much important, because there are drugs which you can divert, or you
Mm-hmm.
have differential diagnosis, what we call it as. So there are remedies for for triggering of asthma by cold drinks, you find the other medicine.
Right.
For triggering of asthma by dust, you have another medicine. For triggering of asthma, after
Oh,
bathing from cold water, you have another
for
medicine.
allergies, basically, you
Yes, yes.
have different for
You
different
have different
allergies.
medicine for
Different
different
allergies.
triggers.
Oh, okay.
So that's how you will end up into proper medications if you make a note of it properly.
Mm-hmm.
So this is this is what I mean to say. Have a proper case history. A well
Okay.
taken case is half cured. What we generally tell.
So case history and the root causes are really
You
important.
definitely need to maintain a
Yeah.
notes.
You can't randomly take
No, no, no. It's not
drugs.
possible.
Yeah.
It's not possible, and you cannot blame anyone, because you are the one who knows the things you are facing.
Right.
So you are the right person who can comment on it.
Right. So, before we end this, what is like the one, pro tip that you're going to give to all our, upcoming generations out there
I would
with
definitely,
all your experience?
yes, I would definitely tell. It is like somewhat difficult to follow, but I would definitely like to tell because I see a lot of patients these days wherein they can manage the lifestyle properly, but they are unable to do it. So because of which they are facing a lot of issues.
Right.
So I definitely would like to tell them as far as they are aware and as far as it is possible, make sure that you avoid high protein, have a mixed diet, have a mixed diet,
Balanced meal.
balanced diet, have a balanced diet, and you do not specifically try on any simple diet like whether keto diet, Mediterranean diet. You do not go for it. Just have a balanced diet and have a regular exercise, and if possible make a stress-free life, stressful life, proper sleep, and have a common conversation with your family members or friends, have a chit chat. That's
Okay.
how you can avoid many of the illnesses.
Okay. So a balanced meal, spending time with your loved ones,
Yes,
lots of water, and exercise regularly.
not lots of water.
Yeah, like
Have water
whenever.
whenever your body says.
Yeah. So
It
keep
reminds
yourself
you.
hydrated,
Yes, it
basically.
reminds you whenever your
Right.
body needs water, it reminds you. So you just have water whenever your body reminds you to drink water.
Okay.
And do
And
not ever see all the videos which are inspired by the other person other than the treating doctor. Okay,
got it.
because I have seen many people many patients these days, they see some some social media,
Mhm.
and they use all sort of things they just suggest.
Right.
Like I definitely tell instead of listening to them, I definitely would suggest you just listen to your treating doctor, whoever it is,
Then
qualified
randomly
and treating
Google
doctor.
as
Yes,
well,
it is
like
not safer, it is not
yeah,
safer, because Google cannot replace a doctor,
true.
whether it is a homeopath or allopath, whoever it is. But you trust your doctor, treating doctor, and have a safer life.
Okay. It was amazing to know a lot of basics about homeopathy, basically. Thank you for, giving us your valuable time. Thanks for being here.
Thank you very much. Thank
So
you.
thank you guys for tuning in from, globally, and hope you guys had an amazing Thanksgiving weekend. See you all very soon. And if you guys have any, suggestions or, just drop in your suggestions and, yeah, we'll get back to you guys. Thank you.
Thank you.